Hey, what up guys, Soccer Doc here. In this video we're going to be discussing chronic groin strains, groin strain injuries, adductor tendinopathy, how to heal from this injury. Now this video is brought to you by the support of one of my subscribers, loyal subscribers, LMO7. This video is for you, and thank you for all my other subscribers as well. Thank you for your continued support. Now this kind of injury, what is it? We're going to break down what it is and the stages of it and how we can heal from it, which exercises I best advise. Now my first thing I have to say is, no other YouTuber actually says this, is that there's nothing beats getting an in-person evaluation. I recommend you first, if you've been suffering from this problem, whether you just did or it's been a long time, get an in-person evaluation from one of the best physiotherapists you can find in your area, or a doctor who specializes in sports injuries. That's number one. Check that out. And if you have any unusual lumps or bumps in there, get it checked out. Now this groin strain, this adductor tendinopathy injury, especially when it's chronic, what's going on? And even when it just happened, what's going on? So these muscles are within our inner thigh. These are 5 major muscles within our inner thigh. They have short length muscles of these adductors and are longer length muscles like adductor longus, adductor magnus. Now, we don't really need to go into that too much. How does it commonly happen? I see this happen a lot in athletes who do a lot of repetitive running, whether it's cross country, whether it's soccer players, also athletes who do a lot of repetitive movements, swimmers, gymnastics, they tend to get this often. How can you prevent this injury? And how does it normally happen? Because if we can learn how to prevent it, we can prevent it from getting worse and from happening again. So prevention strategies. 1. A lot of these athletes get this from having improper muscle flexibility. You need to make sure your hamstrings are as flexible as your quads, and all along, all the muscles have to be equally flexible. 2nd, poor core strength. If you have poor core strength, your hips are swaying everywhere, you're imbalanced, your risk of injury goes up. 3 is not a proper preseason training. You need to have all your muscles ready. If you play a sport like soccer where you're doing a lot of sprinting and jumping, you need to be used to those activities so that you can sustain that during the season. And then the 4th thing I see a lot is improper warm-up before activity. They jump straight into it in a sport like soccer where you have to do a lot of sprinting, a lot of jumping, and that can put a lot of strain on these tendons. Alright, so that's it for there. Now I want to go into which exercises you can do. Now there's not one, I've did the research all day this morning, there's not one set protocol of what you should do for this injury. So let's go into it. If you're in the acute stage where this injury just happened, it just happened a few days ago, and you're feeling that pain inside the medial part of your thigh and your inner thigh, what you need to do is the RICE method. Rest, ice, compress, elevate. You want to be icing for 20 minutes at least 3 times a day, right where it bothers you the most in that inner thigh area, because what you want to do now is decrease inflammation. In the acute stage, when it just happened, you also want to avoid stretching. You want to do more isometric strengthening, and these are the exercises we're going to go into in this video today, which exercises to do. Now, most athletes I see, they've gone through the acute phase, now they're still feeling pain, just like LMO7. What do you do now? So there's stage 2 and stage 3. I go by the protocol adjusted from the research study by Cook et al. I'll post a link of it at the bottom in the descriptions here if you want to read his full research study. Physiopedia.com is also another great resource I use for this. So these are the exercises I'm going to take you through now. Isometric exercises you can do, and then eccentric strengthening. Studies have shown that just passive healing of this doesn't really help much. If you just do icing, let's say it's already been months and you're still feeling the pain, it's been 4-6 months, still feeling the pain, research has shown that proper strength training is what allows the collagen and the fibers to mix together and form a perfect unity. Because with this injury, what's happened is your collagen, these muscle fibers that attach muscles together, and your muscles are attached together, so the muscle fibers, they've been torn apart and they're just not as properly aligned. Now, proper strength training has shown through research to reestablish that matrix, reestablish the proper muscle alignment, and that's our goals here. If any of these feel painful, then stop. Let's get to it. Alright guys, first thing I recommend you do, once it's already been several weeks, once it's not the acute stage anyway, you've had this for a couple of weeks now, you want to do a soft tissue massage. Either use your hands with some lotion to massage across your muscle belly, or use a tennis ball or foam roller or a massaging tool. The goal for the soft tissue massage is to promote blood flow. Blood flow is very important for the healing of the muscle, especially if it's already been a long time since you've had this soreness there. Reduce soreness and improve comfort. You want to press with firm pressure, but not too hard. Even just a tennis ball will work fine, but honestly I prefer my hands with some lotion or a kind of massaging tool. Alright guys, next thing you want to do is stretch those muscles. Again, this is not to be performed in the acute stage. Don't do this immediately after injury. Wait a couple of weeks. Now, this is the short adductor muscle stretch. It's more for our shorter muscle stretches that we spoke about in the beginning of the video. The next stretch I'll show you, it's for the longer ones. Now to hold this stretch for about 30 seconds, I'd perform this about 3 times. Do not perform this if this is painful or uncomfortable. This next stretch is for our longer adductor muscles, adductor longus and adductor magnus. Just lean into the stretch, keep your foot flat on the floor. Don't rock. I see a lot of my patients rocking or athletes rocking. You don't want to do that. Hold steady, feel the stretch and hold it. 30 seconds, 3 times, and you want to do both sides. Again, do not push beyond pain, and you should not be feeling pain with this, and do not perform this in the beginning. Do not perform this in the acute stage, the beginning stages. This is more if you've had the injury for a few weeks to a few months now. Alright guys, the next form of exercise is strengthening exercises. We want to perform isometric strengthening. Lay sideways and lift your injured side up towards the ceiling. Hold for about 10 to 12 seconds. Repeat this about 8 times. This is called isometric strengthening. It's one of the first forms of strengthening we can perform. And this is a special form of strengthening because your muscle is not lengthened, so it should be a lighter load and should feel more comfortable on your muscle. Like I said, there's not one proven strength strategy, whether eccentric or isometric or concentric, so it's good to perform all 3. Hold this for about 10 to 12 seconds. This should not feel painful. If it does, stop this exercise. Alright guys, the next form of exercise is another isometric strengthening. Have a band tied around below your knee. You want to pull the band in with your knee, hold the same for about 10 to 12 seconds, and then relax. You should feel some tension in that injured muscle, but it should not feel painful. Do this about 10 times as well. If this feels painful, then stop. It's best to have the band about 90 degrees coming straight out. My table leg just wasn't as high, so I had to improvise. But either way, I did feel the muscle working. And if you tap the inner thigh muscle, this should help with the muscle activation even more. The next form of exercise is both a concentric and eccentric exercise. Lie on the floor, tie the band slightly above your ankle. What you want to do is pull the band in against resistance, hold for a few seconds, and then slowly return starting position. Pull in, hold for a few seconds, and slowly control your movement back in. Slower the better. Check it out from a different angle. I would advise even pulling your leg in at different angles. Some pulls you want to pull in a little higher, hold, and then slowly return in. You're in control. Don't let the band pull you. You slowly return to position. And then at other angles, pull in from a little lower of a distance. And practice turning your foot in and out as well, so they can get different angles and different force and strengthening upon your adductor muscles. As you pull in, this is considered concentric, your adductors are shortening. As you're being pulled out, this is considered eccentric, your adductors are lengthening. All are important muscle contractions that happen during a soccer game and during any activity. Next exercise are hip sliders. This is a great hip adductor strengthening exercise. It's considered eccentric because your hip adductors are lengthening while they're holding on to force. What you want to do is slowly slide your foot out and come back in. Slowly slide your foot out and come back in, and you want to feel in control the whole time. I need to do some more strengthening because I'm even losing some control during this exercise. As you slide your foot out, you want to maintain control, go in a slow movement pattern. This next exercise is standing band adduction. This is another concentric and eccentric exercise. Slowly, as you're standing, pull the leg in, and then slowly control your leg coming back out towards the band. Now this you want to have control the whole time. The band is going to be trying to pull you in, especially if you have a smaller, tighter band. You want to be in control of the entire movement pattern. With this exercise, I also recommend you hit it at different angles. Sometimes pull your leg a little bit more forward towards the front of your body. Other times bring it to the middle, and other times bring it towards the back. Next exercise is the Copenhagen side plank exercise. This is one of the highest levels of eccentric strengthening you could do for the hip adductors. Only do this if all the other exercises shown in this video feel pain-free. This is the highest level of tensile force you can put in adductors. Now I apologize for not demonstrating. My form is just so poor, I didn't want to show you guys the incorrect form. Now for this exercise, what you want to have is have your top leg stable on the surface, and your bottom leg you want to raise it up towards the surface, hold for a few seconds, and then slowly drop down. I recommend you only do this if it's pain-free, and I recommend you look online for different sources showing you how to properly perform this exercise. Now it is one of the last phases of strengthening. Only do this if the others are pain-free. Alright guys, I hope you enjoyed this video. I hope these exercises prove to be helpful for you. Again, if any of them feel painful, do not perform, do not continue performing. Only do it in pain-free ranges and work your way up to it. And Elemental7, one of my subscribers, thanks for your support. Thanks for always commenting on my videos and your support. I hope these help you, man. I hope these help you. And thank you guys for watching. If you're new to my channel, please hit the subscribe and like button to help the algorithm. Thank you for joining me. Please comment in below any questions and comment any other video you'd like for me to make in the future. Okay guys? Alright, all the best. Have a great day, Soccer Doc.